Hello, welcome. Thank you very much for being here. One of the things I want to say at the start is that this is not the same as the breath work that many people are teaching around the world today. That type of breath work that we mostly see taught in festivals, in workshops all around the world, involve what we call hyperventilation, breathing more than you normally would. And hyperventilation is also a sign of sickness. I'm not saying it's wrong to do this. There are times when it's okay to do it, but the risk is that you reduce blood flow to the brain, you hypersensitize your nervous system, you reduce the entry of oxygen into your cells. So you'll probably have to eat more because when you reduce entry of oxygen into cells through overbreathing, you actually end up getting 1/19th the amount of energy output. So the two biggest things I want to stress in this type of practice is that it's not wrong to breathe more than normal, but it doesn't have good long-term results. And even the results that people say it has, which include many times people say it's good for focus or for enhancing emotions or for reliving past memories. I'm not saying any of these techniques are wrong, but for long-term health, they're not good. And so think about this. When you see someone running, if they're not breathing much, we call them a fit, healthy person. When we see someone sitting or walking slowly and they're breathing a lot, we know they're sick. Sometimes, and this upsets people when I say this sometimes, you walk into a yoga class and you see people breathing like, and you go, what are they doing? Are they pretending to be sick? But don't get me wrong when I say that. I'm sort of semi-joking at the same time. But beware of this, that breathing more than normal is generally considered an expression of sickness. So how about this? Is it possible to do 5 full breaths in 1 minute? I think almost everyone here could learn that very, very simply. Is it more difficult to breathe 1 breath in 5 minutes? I think we'll all agree that's a more difficult practice. And if you wonder about pranayama, for example, the Indian yoga breathing technique, there is a beautiful book which you can get on Google, and it's for free because it was published in 1855, and it's called A Treatise on the Philosophy of Yoga by a doctor called N.C. Paul, who studied at Oxford but also learned very, very good yoga. And when you read that, he says that the first stage of pranayama is when you can basically breathe 1 breath every 5 minutes. And if I had to tell people what is pranayama, what is decent breath control, I'll compare it to natural breathing. And natural breathing is approximately 10 to 15 breaths per minute. And in each breath, there is maybe 1/10 of a lung of air filled up. So if you work out what minute ventilation is, the expression of how much you breathe, it equates to, and I can do this mathematically at another time, natural breathing for most people is the equivalent of 1 full breath per minute, approximately. So when you're doing your breath control, if you are breathing more than 1 full breath a minute, that's technically, medically, scientifically called hyperventilation, overbreathing. There's lots of theory behind breath control, and that theory is, I'll summarize very quickly, but if you want to learn it more, then please consider joining my 2 courses. 2 most important things that you should do with your breathing are generally breathe as little as you can in the activity that you're doing, which is what we do in our deepest, most regenerative cycle we call sleep. Someone who's hardly breathing at all when they're asleep, you know they're healthy. But someone who's breathing a lot when they're asleep, well, you definitely don't want to sleep next to them. They're usually not good to sleep next to, but they're usually sick. So number 1 thing is breathe as little as possible, learn to do that, develop that ability, and you get many benefits. And the second thing is learn how to use your muscles of breathing. Now, we use our muscles of breathing most when we exercise. So many of the benefits of exercise are that you're actually using your diaphragm, your chest muscles, and all of the muscles of breathing, including your psoas, your pelvic floor, your shoulders, your arms, your legs, using your spine. So this use of the muscles of breathing is part of what in Indian yoga they call Kriya. And Kriya is the first stage of Hatha Yoga. And Kriya is often forgotten in modern yoga, but it's very, very important. So I'll give you a demonstration of some of the Kriyas. And one of the Kriyas I'll show you is Naudi Kriya. But Naudi Kriya often is taught in a way where you're not breathing at all and you're controlling the muscles of breathing. I can also show you this while breathing or while breathing naturally. So that's the summary of the theory of the practice. The best way you can work with breathing is to minimize the amount of air that comes in and out of your body, but maximize the use and the control of your muscles of breathing. So for that, we need several different practices. And what I'm offering you tonight is 4 main practices. The first one is possibly the easiest one, and that's to do with restoring natural breathing, which is the most important thing you can do to get a better night's sleep, to give you better energy. Once you restore natural breathing, you get better weight control. You also get better nervous system control and better immune, digestive, and reproductive control. So this is the number 1 section. So if you only stay for part of this seminar, then the first part is all about restoring natural breathing. Now, when we go further than that, an important thing to note is that the concept of Indian yoga pranayama, which is discussed in the 2nd chapter of the Sutras of Patanjali, is something which is a precursor for what they then talk about in the 3rd chapter of the Sutras of Patanjali, where they talk about the siddhi powers, the supernatural powers. So potentially then, if you're wanting to learn the supernatural powers of yoga, take one first step. And the first step is go from the normal dysfunctional breathing and over tense and over breathing that most people do, restore natural breathing. And then natural breathing becomes the base for the supernatural breathing that is initiated with pranayama. So whatever I teach you in the first part of the practice, in particular how to use your diaphragm to expand the pelvic floor as you're breathing in, to breathe in low, then the second practice we'll be doing will be how to enhance inhalation and exhalation. So the first part of that will be I'll show you how you can inhale for 2 minutes, exhale for 2 minutes. Now, not all of you will be able to do this, but here's where I give you a really important hint, a tip. When you're trying to work with breathing in a controlled way, don't think breathe in, breathe out. Rather think expand your trunk, and that will allow air to come in. Think contract your trunk. That will allow air to come out. So, for example, when I move my hands apart, you hear a suction. I pull my hands apart. I'm not putting air between my hands and that pushes my hands apart. It's making a space increase, a volume increase between the hands that causes air to come in and out. So if I want to breathe in my chest, I don't think suck air into my chest. I think expand the upper back outwards and the chest forwards. And then air will naturally come in if I was not talking and breathing naturally. So don't think breathe in, breathe out. I'm going to show you different ways of expanding your body to allow air in, gently contracting your body to allow air out. Now, this is taught very effectively in my courses called 5-Dimensional Flow, but I'm going to give you a hint how to do it in this practice today. The second practice is emphasizing long inhale, long exhale, and that will be something which I'm talking about just expanding and contracting. So if you see when I say keep breathing in, you can't breathe in, it doesn't matter. Just breathe naturally and just focus on the inhale, exhale. The results will come not because you've managed to do a certain type of breath, but look for a sense that you're getting warmer without your heart racing and more relaxed. Increased blood flow while being relaxed are the 2 most important physiological parameters for your ongoing health, happiness, and longevity. Then, the next most important thing is that you use your muscles of breathing in a way which massages your spine, mobilizes your spine, and mobilizes your internal organs. The third practice is a practice which I call autogenous hyperbaric oxygen therapy, where essentially you'll be doing what in Indian yoga they call the application of Mula Bandha, Uddiyana Bandha in their compressive and expansive forms. And there's different names that we use in pranayama for this, but in the West, It's related to what they call Valsalva maneuvers and Mueller maneuvers. And when we do this practice, you'll see I caution you. It's not for people with blood pressure problems or headaches or those in special conditions. For those of you who have got those situations, please just breathe normally at that time and focus just on expansion, contraction. If you overdo a contraction while holding the breath in or out, you can get dizziness, nausea, or if you overdid it, you could get a stroke and die. So that's a more advanced practice. That's our third practice for the session today. Then the fourth practice we'll be doing is focused on the pelvic floor. Many people talk about the pelvic floor as being very important. The pelvic floor is not Mula Bandha, as many people think it is in the modern world of yoga. The pelvic floor has three parts. The front is the urethra, the middle part the genitals, and the back part to do with the anus, obviously different in men and women. But if anything is to do with Mula Bandha, it's to do with the central section. It's really important that you differentiate the central part of the pelvic floor and learn to control them individually. But the exercise I'll be offering you will be a twofold exercise where you first learn to tighten the whole pelvic floor, and then you not just relax it afterwards, you learn to expand it in a gentle way afterwards. And this is really important because many people's pelvic floor is way too tight. In this session, I'm going to go through 4 main breath control practices. While we're doing these practices, it's really important that you don't do anything which feels uncomfortable. I'd like you to always be in a comfortable position and always know that whenever I suggest anything to do with the breath, it's always your choice to go back to natural breathing whenever you like. So the first of these 4 exercises is actually the restoration of natural breathing. So let's begin with that. What I'd like you to think about is 5 main things with natural breathing. The first is that the inhalation part, the breathing in, is low in your body. The second is the exhalation must feel relaxed, not increasing your tension. The third thing is you breathe through your nose. The fourth thing is that there's as little breath coming in and out of your body as possible. What we call the minute ventilation, the amount of air going in and out of your body per minute, which was effectively the number of breaths per minute and the volume of each breath multiplied together. That's called your minute ventilation. Healthy people have low minute ventilation based on what activity they're doing. Obviously, if someone is just lying down doing nothing, their minute ventilation will be low. And if someone's running fast, their minute ventilation will be greater. But what you want is for whatever activity you're doing to keep it as low as possible. And it's this that's going to give you more blood to the brain, more oxygen to your cells, better output of energy for all the food that you eat, and will also keep your nervous system calm. The more you increase the amount you breathe, the more you increase your minute ventilation, the less blood goes to your brain, the less oxygen comes to your cells, the more nervous your system seems, and the more hypersensitive you are, and also the more you want to eat. So, make this most important part of breathing to be breathe as little as possible, subject to not causing problems. The fifth aspect of natural breathing is you can forget the breath. And to help you forget the breath, I'm going to ask you to continually focus on 6 main regions inside the body. And these places I want you to think about, but ideally also lengthen. Ideally really think about relaxing them, lengthen them, and perhaps move them slightly while keeping them lengthened and relaxed. So these places are, number 1, the fingers. You can do this with me now. Lengthen your fingers. Check the fingers can move. Number 2 is the shoulders. So move your shoulders as far away from the base of the back of your neck as possible. And check your shoulders can roll smoothly in any direction, just provided the movements are smooth, not going back and forth in the same direction. Third thing is the neck. Check the front, back and sides of the neck are equally lengthened, and you can gently move the neck, either in a figure 8 like I'm doing now, or in a sense of a chin in, up, forward and down. These are 2 good ways to move your neck gently. The fourth place is your pelvic floor. I want you to keep your pelvic floor as open and relaxed as you comfortably can, generally, unless I say otherwise, and relax and expand if possible. The front of your groins, the crease where we sit, and also your sacroiliac joints. And it's also useful if you move this region as well. Not always, sometimes, but at least think of it, relax it, perhaps make space there, and perhaps move it. The fifth place is the region of the lower trunk. Always check that the region between the top of your hips and your tailbone, where I'm touching now, between that is the L5-S1. Make sure this region is lengthened, and if you're standing, you can do it by bending the knees slightly and dropping your sitting bones down, like a weight on a string, which is your spine, to lengthen the lower back. Then also relax fully at your abdomen. Let your belly be as soft as you can in whichever position you're in. Sometimes the abdomen has to firm. So for example, if I have my fingers in the soft abdomen and lean back, and you can try this, push your fingers into the soft abdomen, bend your knees, push your pubic bone forward, lean back, and you'll see the abdomen pushes out and hardens against my fingers. So then you'll see the front of my abdomen is fully firm, but the sides of my abdomen, I'll just roll up my t-shirt, are totally soft. Only firm what you need to firm in your abdomen. Similarly, if you were to twist, and what I'm going to do is move my knees and my pubic bone one way, and my belly button and my trunk the other way, that will cause the abdomen to firm fully. But notice it pushes the abdomen away from my fingers, and my fingers are inside. And that firmness is what we call firm but calm. In yoga, they say sthira sukham asanam, firm but calm, meaning I can easily still breathe into my abdomen. So it's important, really, that when you focus on your lower trunk, check especially that the L5-S1 junction below the top of the hips is open and not compressed. That's your energy center. And that you can breathe into the abdomen. So your diaphragm is working when you breathe in the abdomen. And the sixth place is your face. And I want you to think about, make your saliva come easily, make your jaw move lightly and soft and relaxed, make your lips be comfortably able to move in nice yummy ways like kissing and smiling, and let your outer eyes be able to open and close like a slow motion blinking action. So doing these actions is something that if you repeat them and do it one more time with me, you get an effect. So lengthen your fingers, check the fingers can move. Keep them going if you can, stop if you need, to move on to the second thing, which shoulders apart, shoulders can roll. Keep them going if you can, or leave them, go to the third thing. Check your neck is lengthened, your neck is free. Keep them going if you can, or go on to the fourth thing and leave the shoulders, wrists and fingers alone. Move your pelvis. Check your pelvic floor is relaxed, and the pelvis can move with the front of the groins as open as they can be, and your sacroiliac joints open. The fifth thing is checking your lower back is lengthened. Check your abdomen can breathe or roll like mine. As you can see, I'm bringing my lower abdomen in and out. And so I'm making my diaphragm move up and down with this, and I'm using my transversus abdominis muscle. This is not everyone can do, but if you can, do this. And the sixth thing is your face. So now go again. Kiss, smile, make saliva, move your jaw, your lips and your eyes. So if we do this, then you forget the breath, but the breath is happening underneath at the same time. So revision: to reset your body back to natural breathing, approach it by going breathe in low, pelvic floor, lower abdomen, sacroiliac joints, lumbosacral spine, expanding slightly when you breathe in, and you can feel that when you breathe in. And the exhalation is soft, so there's no extra tension, but maybe if you're able to, you can draw your lower abdomen in like you see me doing now. So my abdomen's going fully in now, but it's not hardening excessively. So there's a very soft, so when lower abdomen is in, upper abdomen is still out. Most people can't do this, but if you can learn it, and I can show you ways of learning it in my course, then that's a really good thing to help mobilize your spine, mobilize internal organs, and it's the key to what in India they call pranayama. Okay. So by doing these 6 things at once then, you start to forget the breath. All right, so natural breathing can be done in any position. Probably the simplest place to learn it is lying on your back, with your knees a bit bent and a bolster under the knees, something like this. So if you wish, you can practice it like this, with your lower back flat to the floor, and you could put your hands on your chest and hands in the abdomen, and when you breathe in, the lower abdomen expands, lifts away from the floor, and when you breathe out, it just naturally goes down toward the floor. So you breathe in, expand pelvic floor, lower back, expand the abdomen, soften the face, neck and throat, and then let the air out softly by itself. Don't do too much of this so you can experience dizziness, but every few moments where you can, just check that when you're breathing in, the inhalation is low, expanding pelvic floor, lower back and abdomen. And when you breathe out, the air goes softly out by itself because gravity is pushing it out. And as you're doing this, check the fingers are lengthened, relaxed, maybe they can move. Shoulders apart, relaxed, maybe lengthened, perhaps can roll. Neck lengthened, neck is free. Pelvic floor totally open, relaxed, expanded. Pelvis could perhaps move. Lower back lengthened and the abdomen can breathe or roll. And then face relax, kiss, smile. And this helps you re-establish natural breathing then. All right, if you're lying down, sit back up and we'll try and do it seated. So sit either in a chair or on the floor or on a bolster. I'm doing something in the middle. I'm sitting on a high chair, a high stool, but you don't want your knees higher than your groins. So in this case, I'm going to cross my legs a little bit, like sitting on a high bolster. Have your knees just below the groins so that blood flows down. Otherwise, the blood won't flow into your legs. Have your hands rested on your knees, ideally, and adjust yourself so you're sitting up straight. So what I'd like you to experience, and I'll turn sideways periodically so you can see, is your top hips are above the sitting bones, your lower front ribs are in, and you're lengthening fully like this. Now, what I'm going to do is I want to show you my trunk, so I need to put my speaker on my head, and it's going to look a bit funny, so excuse me, I'll just do that now. It looks a bit funny, I know, but it means then I can talk to you and show you my trunk, which of course is an important part to demonstrate if I'm talking about breathing. So, if you're sitting, have your knees just below the top of the hips. Make it so you're not uncomfortable. Make it so you know you could sit here for ages. I'm going to turn sideways and show you what I'm doing sideways as well. But you keep facing towards me. So, what I'd like you to feel is that the top of your hips, your iliac crests, are directly above your sitting bones, and your head is directly above the hips. Now, everyone's spine's a bit different, and we've been messed up a little bit by sitting on chairs for so long. So, when you adjust your spine, have it so that the sitting bones drop down like a weight on a string, which is your spine. The top of your hips are slightly back further than many people put it. Some people try and sit up straight by moving the top of your hips forward. That will tense your back and close the back of your core, the back of your enteric nervous system, your gut brain, your energy center. So keep the top of the hips slightly back so you open up the L5-S1 junction below the level of the top of the hips. You see my fingers are touching the top of the hips here. The L5-S1 junction is about 2 centimeters below that for most people. That needs to be open, and it might even slightly round out a little bit like it does on me, and that comes from years of sitting on chairs. So, when we're breathing in then, I'm going to talk about 12 key places to expand and contract. And don't think breathe in, breathe out. Think expand and contract. So first, just natural breathing once again. Lengthen your fingers, move your shoulders apart, lengthen your neck, widen between your sitting bones and relax your pelvic floor. Round out your lower back slightly, move your top hips back, your lower front ribs back, and feel the skin of your spine, the skin of the back of the neck.
Now relax your abdomen and sense when you breathe in, and you can use your fingers, the inhalation is low in your body without the ribs sticking out. Exhalation can be relaxed, or if comfortable, when you exhale, you draw softly your lower abdomen inwards like I'm doing now until the air goes fully out. But be careful, this muscle is not meant to be hard, so I can still touch the abdomen. Now once my abdomen is in like this, although it feels soft to touch and it's in, when I breathe in again, I can directly feel the abdomen expand, even though the abdomen is still in. There's my abdomen out, abdomen in. I can hold my fingers in there, but when I breathe in, I can still breathe in my lower abdomen. Just differentiate this with how many people will tighten their abdomen. Put your fingers into the soft lower abdomen again and exhale forcefully. Forcefully means tighten your pelvic floor. Exhale, draw your navel right into the spine, pull it away from your fingers and make your abdomen hard. Keep your abdomen hard, keep your abdomen in. Now try and breathe into the abdomen. Notice the chest starts to move for most people. This is stress, and we don't want that. You always want to check that whether your abdomen is soft or hard or in or out, you can still breathe there. Let me give you an example about how you can breathe into an abdomen that's firm, but you can still breathe there. So from where you are on the chair, lean back slightly. Make sure your spine feels okay, and feel how the front of the abdomen feels firm to touch. But now feel the abdomen and try and breathe in low. And notice with this type of firmness, you can breathe in the abdomen. And this is what we want. Whether the abdomen is soft or hard, you should always be able to breathe there. And so this is natural breathing. So when we're doing it in the seated again, let's try it for a moment. And to help you breathe naturally, let's just begin with these first four features and then forget the breath. So number one is lengthen your fingers. Check the fingers can move. Keep them going if you can. Number two, shoulders apart, shoulders can roll. Keep them going if you can. Number three, check your neck is lengthened but your neck is free. Number four, relax your pelvic floor and maybe move your pelvic floor in a figure eight or a circle, periodically changing from clockwise to anti-clockwise. And then number five, with your lower back lengthened, check you can breathe into the abdomen or roll like me perhaps. And number six, relax your face. Saliva, kiss, smile, chew. Half open, half close the eyes. And let your inner eyes look up if you can, slightly. Relax your face. Notice the body starts to get warmer without the heart racing. This is the prana. And this is what comes if you just unblock the blockages to natural breathing and natural blood flow. And release. Let's try doing natural breathing when we're standing. So to do that, what I'd like you to do is stand and follow me. I'll turn sideways so you can see. And I just want you to do this exercise. Start with your knee bent. And then use your fingers to move what I'm moving. Use your fingers with a pulling action and a pushing action. Pulling and pushing. So fingers moving towards a closed fist. And then fingers expanding and palm expanding. Bend the knee slightly. Then expand the pelvic floor, lower back, upper back. Lift your shoulders. Expand your chest and expand the abdomen. Bend the knees slightly, draw your lower abdomen in if you can, round out your lower back, push in your middle and upper back, keep bending the knees slightly, bring your chest and abdomen in. Where the part I'm talking about, I'm pointing to. So expand the pelvic floor, lower back, upper back, slightly rounding the back out as you lift the hips. Lift and expand your chest and your upper, then lower abdomen fully as you almost fully straighten the legs. Now move the weight towards your toes, point your fingers to the lower abdomen, try and draw it in slightly, then use that to round out your lower back. I'm making that shape with my fingers, you should do the same. Then push in the middle and upper back, so lower back, slight forward bend, middle upper back, slight back bend, lift your shoulders up, then bring your shoulders forward and use your fingers to suggest to push in your chest. Push in the upper, then lower abdomen. I'll make click sounds for this. 1 click, come away from the floor and expand, first the back of the body. Away from the floor, expand the front of the body. And then 2 clicks, go down and contract. Lower abdomen goes slightly in as you bring the weight on your toes. Round out the lower back and push in the middle and upper back. Push in your chest and push in the abdomen. As light and soft as you can. Again, expand. Turn your thighs slightly in and feel opening in your sacroiliac joints. Round out your lower and upper back. Then come to the middle of the feet and expand, lift the collarbone, expand upper, then lower abdomen fully open. And then bring the weight towards your toes. See if you can use that to gently draw your lower abdomen softly in. Then use that to round out the lower back and push in your middle and upper back, bending the knees further. Push in your chest, push in the abdomen, and you've come to the middle of your feet again. Another cycle. Turn your thighs in slightly and expand pelvic floor, lower back, upper back as you lift up on the heels. Come to the middle of the feet and expand, lift the chest and the abdomen. Then draw your lower abdomen in, bring the weight over the toes, round out your lower back, push in the middle and upper back. Then come to the middle of your feet and bring the chest and abdomen in. Continue with me. Be as soft as you can. Lifting away from the floor with the single clicks and coming closer to the floor on the double clicks. Don't think breathe, think forget the breath. Move your fingers. Check your shoulders are relaxed and opening. Check your neck is relaxed and always looking straight ahead with the eyes. Check your pelvic floor is soft and open, especially around the anus. And check your face is relaxed. So as you come up and down, smile, let the eyes open and lift the inner eyes when you come up. And when you go down, gently kiss. Gently half close the eyes if you can. And the inner eyes go down. Expand, turn your thighs in, lift and lengthen the back. Expand the front. Draw the lower abdomen in, come weight down on your toes. Then come weight to the middle of the feet. Expand, soften throat, face and eyes. Expand. Gently contract. Gently contract. Okay, have a rest for a moment. See if that made you feel a little bit warm. What's happening when we're doing this is hopefully you're forgetting the breath. But because you're forgetting the breath goes back on automatic. And because you're going up and down with your hips, the muscle that comes on the inside of your thigh up the front of the hip called your psoas muscle, that muscle connects to your diaphragm. So this movement will make you breathe in when you lift up and breathe out when you go down. Don't think you should breathe in, it's going to happen naturally. You can feel this if you like, if you bend your knees and touch your thumb against your nose, they come up, and you'll feel a bit of a suction. But if you go down with your thumb on the nose, it's more like your nose wants to breathe out. Come up again with thumb on nose, go down, up and down a few times. And you'll notice, when you come up, it feels like there's a suction on your thumb because the nose will very, very gently be trying to breathe in at that point. Because the hips, your psoas in particular, connects to your diaphragm. And so this type of movement, which is a little bit like walking with 2 legs at the same time, is something which facilitates natural breathing. As an aside, when you walk, don't think breathe, think relax and move your hips, move your spine. You get a good result. When you work with coming up and down like this, what I notice when I'm using my heart rate monitor is expanding coming up makes the heart rate go up. contracting, going down, makes the heart rate go down. So actually, here my heart rate's 55 beats, 65 beats, 75 beats, and then it starts to go down. 65, 55, 45 beats per minute. So this simple exercise of move the body up and down while relaxing will make air go in and out, but it also makes your heart rate change in speed. This you can see with a heart rate monitor, and actually it doesn't matter whether I'm breathing or not. It still affects it. So the most important things that you can get from breathing are to regulate heart rate variability, the biggest indicator of internal health, but also if you can learn to use your muscles of breathing as much as possible, your trunk muscles, your diaphragm, your chest muscles, your abdominal muscles, while breathing hardly at all. And you've seen how when I lean back, my front is firm, my sides are soft. You've seen also how I can control my abdomen in different ways. You can see my lower abdomen moving in and out like this. If you can do this without breathing, it's fantastic. I can circulate my abdomen. You can see I'm circulating it in and out, left and right. But I can do the very same thing without breathing. I can breathe into my chest with my abdomen soft. It takes some time to learn that. But I can also pretend to breathe into my chest with the abdomen soft, like this. This is called Uddiyana Bandha of expansion. I can also create a Mula Bandha of compression and a Mula Bandha of expansion, where you'll see first my abdomen push outwards and forwards, the same as front firm, side soft. This incorporates the Mula Bandha of expansion. But then you'll see me isolate two muscles on the side here, which are the oblique muscles, which is one of the versions of the Mula Bandha of compression. Another version of the Mula Bandha of compression is to draw the lower abdomen in, which will trigger the perineum, but it mustn't tighten the anus. And this is the mistake most people make. Let me demonstrate to you those two bandhas. Then I'll also demonstrate Nauli or Lauliki, where you can control the internal muscles. This is so much fun. I've been doing this exercise since 1968. It is so good. But the thing is, once you understand that you can do it without breathing, you can also do it with breathing. So I often will move my core in different ways. And although I'm very passionate about teaching breath control, another way of getting the same effects is to learn how to control the core, like I'm doing now, while breathing naturally. Or, if you can't control your core, move the whole trunk. And these movements become the 5-dimensional flow that I teach, which has as one component specific breath control. When you're doing a natural breathing and meditation, be still and lengthen. So let's do a natural breathing meditation now. So sit in a comfortable position and again lengthen and relax. So I'll point to where to lengthen. Keep your eyes open in the beginning. Lengthen first by pushing your sitting bones down. Move the top of your hips back to lengthen your lower back. Move your lower front ribs inwards and backwards. Lift and lengthen your upper back. Now bring the head down, the neck back slightly. Lengthen the back of your neck. Now, widen the shoulder blades and widen all the way to the elbows, back of the hand, the fingertips. Now, having lengthened back of trunk, back of neck, back of arms, keep them lengthened. Now lengthen the front. Pubic bone down, pelvic floor open. Move the top of your hips back a little bit more, relaxing and lengthening the front of the hips. Move your lower front ribs inwards more, feeling the skin of the back lengthen. Now expand the abdomen, and without letting your lower front ribs stick out, lift your collarbone. Then, without changing the length in the back of the neck, move your throat forward and lift the chin up as high as you comfortably can. Keeping back of spine, back of arms, back of neck lengthened, having now lengthened front of spine, front of neck, lengthen the inner arms as well, all the way to the tips of the fingers. Think lengthen and relax. Now check first that your pelvic floor is fully soft, that your sitting bones are down, that your abdomen is fully relaxed, your shoulders to fingers are lengthened, and neck is lengthened and relaxed. Now your face. Position the facial muscles. First, tip of your tongue, press lightly against the back of the upper teeth. Second, lips closed, jaw lightly open, so the teeth are not touching. Third, lift your outer lips in a half smile. Fourth, the outer eyelids can close or half close. Fifth, the inner eyes, the eyeballs, if possible, start to look up. Even just a little bit up the level of the horizon, 5 degrees higher than the horizon height. But if you can, let the inner eyes look up towards your third eye center, your pineal gland. And 6, in your faces, relax the forehead. So keep your eyes just slightly open. We'll do the same thing again. I want you to see from the side. So stay still, keep your eyes a little bit open so you can see me in the beginning, and just watch where I point. And later on, I'll point without talking. Sitting bones down. Top of your hips back, lengthen the lower back below the top of the hips. Move your lower front ribs in, back, lengthen the skin of the upper back. Widen between your shoulder blades, go all the way down to lengthen the skin to the fingertips. And have head down, neck back slightly to feel the skin of the back of your neck. Keep the back of the body lengthened, now the front. Pubic bone down, pelvic floor open. Top of hips back, ribs back, abdomen expanded and soft. Lower front ribs kept in, lift the collarbone. Inner arms lengthen all the way to the fingertips. Now keeping the back of the body lengthened. Lift your throat forward, chin up, and lengthen the front of the neck. Now again, the facial muscles, tip of the tongue, curl up to touch the base of the back of the upper teeth. Lips closed, jaw open, slightly. Outer lips lifted in a half smile. Outer eyes half closed or closed now if you wish. And inner eyes lifted, looking maybe slightly above the horizon, or eventually all the way up to the third eye center. 6, make your forehead soft. You can keep going through these lengthening and relaxing instructions in your head like a mantra until eventually you've realized that you've forgotten to breathe. But instead, what you feel is lengthened, relaxed, and warm. Blood starts to flow. Gently open the eyes and follow. Slightly forward, draw your lower abdomen in and expand the back of your body using your arms to suggest. Expand the front of the body, Lift the collarbone, expand the abdomen without shortening your back. Lower abdomen in, round out the lower back, pushing middle and upper back. Chest and abdomen in. Bring your palms gently together. It's a nice way of saluting what we've done. All right. If you got a sense of being warm, if you got the sense of being relaxed, if you got the sense that you forgot to breathe at some point, then you're on the right track with natural breathing. You don't always forget that you're breathing with natural breathing, but for most people, as soon as they think of the breath, natural breathing usually becomes breathing more than normal. And then you're missing the point of the breath. Now, the next most important thing about breathing is to acknowledge that the muscles of breathing are really good to control. It's also good to minimize the amount of breathing, but to learn both at the same time is challenging. So in a short time, I'll give you exercises that will train your muscles of breathing. But before we do that, I want you to learn a controlled pause. So this next exercise we call a controlled pause. And what we'll do is I will give you a set of exercises. And what I'll ask you to do is hold the breath if possible. And I'll suggest you hold the breath. I'll put a peg on my nose. And when a peg is on my nose, it suggests to you that if you want to, don't breathe. But if you wish, go back to natural breathing. And what I'm going to do, I'm going to spend about 8 minutes going through this exercise. And for 1 minute, I'll suggest don't breathe. For the next minute, I'll suggest just go back to natural breathing. Now, most people will have to start breathing within a few moments, 10 or 15 seconds. So I'll always allow that option. But for those who can, go up to a minute if possible where you don't breathe. Half a minute is enough for almost everyone, but I'm going to keep my peg on my nose for 1 minute, take it off for 1 minute. Prepare by sitting up straight again, find a comfortable position. And for this exercise, I'm not asking you to make any big breaths in or out. I'm just going to ask you to do a normal breath in, a normal breath out. And after a few normal breathings, my hand going up and down indicates breathe in naturally, breathe out naturally. At the end of one natural out breath, I'm going to ask you to stop breathing and hold your breath. And I'll put the peg on my nose so you can see. So let's prepare first with a short time of natural breathing, and then we'll do the whole exercise. So begin by lengthening and relax. And as we've done already, lengthen the back of your body, back of the neck, back of the arms. Lengthen front of body, front of neck, front of arms. And check you're sitting up straight with your hips slightly higher than the knees in any comfortable position. Lengthen your fingertips, check they can move. Shoulders apart, check they can roll. Neck lengthened, check it's free. Pelvic floor relaxed, pelvis can move. Lower back lengthened, abdomen can breathe or roll, and face relaxed. Use these movements to forget your breath. Fingers, shoulders, neck, pelvic floor relaxed. Take a normal breath in and a passive breath out. Stop breathing. Stop breathing for as long as you can or until I say. And to help you not need to breathe, forget the breath the same as you did before. Check fingers can move. Check your shoulders can roll. Check your neck is free. Check your pelvic floor is relaxed. Your pelvis maybe can move. Your lower back lengthened and your abdomen is relaxed, or perhaps it can roll like mine. Keep your face relaxed. Kissing, smiling. Breathe if you need. Just simply go back to natural breathing whenever you need. Don't wait so long that you gulp the air. But if you can, a little bit longer. And now make your face move. Helps if lips, smile, kiss. Make a swallowing action. Don't wait too long, but now go back to natural breathing. If you felt you had to make a big breath in and big breath out, you held too long. So restore natural breathing. There might be a bit of warmth perhaps. Check again. Fingers lengthen, fingers can roll. Shoulders apart, shoulders can roll, lengthen, relax. Neck lengthen, neck relaxed. Pelvic floor lengthened and relaxed. Lower back lengthened. Abdomen can breathe or roll like me. Face relaxed, kiss, smile. Relax your pelvic floor, front, middle and back. Drop your hips. Soften your abdomen. Lengthen from shoulders to fingers. Lengthen the neck. Make saliva. Jaw and lips comfortably move softly. Eyes open, close lightly. Inner eyes rotate or circulate. Take another little breath in, and then breathe out, and once more hold the breath for as long as you can or until I say. While holding the breath, then just lengthen and relax. Hold the breath as long as you comfortably can. It might only be 20 seconds. Don't wait too long that you have to gulp the air in. Look for warmth and relaxation. This will come if you unblock the blockages of good energy and loving information inside your body. Lengthen fingers, check they can move. Shoulders apart, shoulders can roll. Neck lengthen, neck is free. Pelvic floor relaxed, pelvis can roll. Lower back lengthened, abdomen can breathe or roll. And face relaxed. Kiss, smile, breathe if you need, whenever you need to. Don't wait too long. Go back to natural breathing when you need. If you can hold longer though without strain, try swallowing. Swallow again, that's 1 minute. Everyone back to natural breathing. And we do a third cycle. So 1 minute of natural breathing for everyone, and then a controlled pause for as long as you can. Fingers lengthen, fingers can move. Shoulders apart, shoulders can roll. Neck lengthened, neck is free. Pelvic floor relaxed, pelvis can roll or make a figure 8 symbol or a circle. Lower back lengthened, abdomen can breathe or roll, and the face relaxed. Kiss, smile, open the pelvic floor at the front, middle, back, drop your hips, relax your abdomen, round the upper back out, check from shoulders to fingers can move, neck is free. Saliva, jaw soft, lips soft, breathe if you need. Soft, breathing naturally. Face soft. Now take another normal breath in and a passive breath out, and hold the breath a third time for as long as you can or until I say. And to help forget the breath, think lengthen, relax. Your fingers lengthen, fingers can move. Shoulders apart, shoulders can roll. Neck lengthen, neck is free. Pelvic floor relaxed, pelvis can roll or move. Lower back lengthened, abdomen can breathe or roll. And face relaxed, make saliva. Kiss, smile, roll your eyes. Breathe if you need, but if you can, hold a bit longer. Pelvic floor soft, front, middle, back. Drop your hips. Belly bloatate, shoulders to fingers elongate, neck gyrate. Tongue salivate, jaw like masticate, lips articulate sweet words like I love you. Swallow. Back to normal breathing, everyone. And to get normal breathing re-established, then lengthen and relax. Fingers lengthen, fingers can move. Last one. Shoulders apart, shoulders can roll. Neck lengthened, neck is free. Pelvic floor relaxed, pelvis can roll. Lower back lengthened, abdomen can breathe or roll like me. Face relaxed. Kiss. Smile. Relax your pelvic floor at the front, middle, back. Drop your hips. Relax your abdomen. Shoulders to fingers lengthen but relaxed. Neck relaxed. Make saliva. Swallow it. Move jaw, lips, gently. Outer eyes open, close, roll. Another normal breath in and a passive breath out and hold as long as you can or until I say. This time perhaps hold a little bit longer than you've done, up to only a minute or more perhaps, and go lengthen. Fingers, check they can move, shoulders apart, shoulders can roll. Neck lengthen, neck is free. Pelvic floor relax, pelvis can roll. Back lengthened, abdomen soft or able to roll. Face soft. Breathe if you need, keep going if you can. Moving your face will help. Masticate, articulate imaginary words like I love you. Half open and close the eyes, make the inner eyes roll, and then continue moving fingers, shoulders, neck very softly, very lightly. This is like you're pretending to breathe, but not. Swallow. Go back to normal breathing if you need. Hold a bit longer if you can with me. It's almost like you're doing a very slow breaststroke swim underwater. Relax. Moving your body circulates energy you don't need to breathe. When you do, gently go back to natural breathing and once again sit up straight. To help you remember to sit up straight, drop your sitting bones down, top of hips back, lengthen lower back, ribs back, lift your upper back, shoulders apart, lengthen all the way to the tips of the fingers and back of neck, keeping the back lengthened. Now expand the front of trunk, front of arms, front of throat, lift the chin, tip of tongue to back of upper teeth, lips closed, jaw open slightly, outer lips lift in a half smile, outer eyes half close or close, inner eyes lift, the forehead soft. Be here, be now, be still, calm and quiet in body, breath and mind.
With this practice, there's no right or wrong, but if you sense that you've gotten warmer without the heart racing, calmer, then you're on the right track. This practice can also reduce headaches and increase energy levels, clear your sinuses, clear your nose. It's one of the most fundamental exercises and really a good step towards better health, happiness and longevity.
Gently open the eyes and copy me again. Lower abdomen in softly. Expand pelvic floor, lower back, upper back. Lift the collarbone, expand the chest and expand your abdomen. Lower abdomen in, round out the lower back, push in the middle and upper back, in the chest and abdomen in. Thank you.
The controlled pause exercise is one that you can do anytime. You can even do it driving. All you're doing is making the same pause that you would do if you were swallowing food or having a shower with water on your face. And it's the safest, most effective breath control exercise you can do. I even have given it to people who are lung cancer patients, people who are traumatized. It's a really, really good exercise. And I really recommend you try it again. I'll record this and send you the recording, and I really recommend you practice it. I've got several versions of it also on my YouTube channel. If you got a sense that you're getting warm, fantastic, and that's the most important thing. This was the easiest breath control practice that I'll be giving you tonight. Now the next one's become more challenging. In the next exercise, I'll be getting you to work towards expanding for up to 2 minutes, contracting for about 2 minutes with a bit of a break. Don't think breathe in, breathe out. It's important you think just expand. Now, it doesn't matter if a little bit of air comes in and out as you're doing this, but eventually this is the method that you can use to have very long inhale, very long exhale, which is an incredible way of bringing you lots of energy and internal health and vitality. So let's begin. This exercise includes making long breath in and long breath out, up to about a 2-minute breath. But don't think breathe in, breathe out. Think expand, allow air in. Contract, allow air out. And if you take extra breaths, doesn't matter. Just look for becoming warm, pain-free, energized, but calm. They're the biggest benefits. All right.
In this next exercise, I'm going to get you to do an enhanced inhalation. And this enhanced inhalation can go up to a couple of minutes perhaps. I'm going to ask you to expand specifically 12 key parts of your pelvic floor, trunk, and spine. And as you're expanding them, it's natural for air to come in. If you master this exercise, it means you can breathe in for 2 minutes. But don't feel you have to. So what's more likely going to happen is you're going to be breathing in, then a little bit of air will come out. That's fine. Breathe in some more, a little bit of air will come out. It's fine. So let the air come in and out as it needs, but think about not breathing in, but think about expanding. With mastery, you will be only breathing in, but don't be in a rush for that. This is a 2-minute inhalation. And eventually you can do the same thing with exhalation. You can also do the same thing with breath retentions. So this practice is a really good way of learning how to hold your breath, but that will require a little bit more learning. Okay, so let's begin once again. And I'd like you to, if possible, use your fingers. You don't have to, but it helps if you use your fingers. The fingers occupy a very large part of your brain. It's part of what we call the homunculus. So if you can use your fingers to guide what you want your body to do, the impact on the brain and then the resultant impact on the brain and the body means you start to be much more effective at the task we're working on. So I'll turn sideways for this one so you can see what I'm doing from the side. Again, sit comfortably, knees below the top of the hips on the floor or a chair or a bolster or a high bolster like me. So this exercise, we're working towards expanding the body. And with the expansion, it's going to be natural that you'll breathe in, but I really don't recommend breathe in. Let the body just allow air in and out as it needs. If you maintain the expansion, if you maintain relaxed expansion, you'll find it will just be inhale.
But don't force it.
And we'll begin with a normal breath in and a normal breath out. My finger guides you. Normal breath in, normal breath out. Now a bigger than normal breath in. And then a full breath out. Draw your lower abdomen in softly and then relax your pelvic floor and expand. Your pelvic floor, expand. The anal mouth especially. Then expand. The sacroiliac joints, notice I'm pulling my hands slightly wider apart to suggest it. Keep the pelvic floor relaxed, sacrum open, and expand. The L5-S1, lifting the upper back away from the lower back, moving the top of the hips slightly back. Now expand the upper back. Notice my hands coming up, fire up the upper back, round out the upper back. Keep the pelvic floor, lower back, upper back expanded, and then expand the back of the neck. Head down, neck back slightly. Keep the pelvic floor, sacrum, lower back, upper back, back of neck expanded. Lift the base of the back of the skull, suggest it with your hands. Keep the pelvic floor, sacrum, lower back, upper back, back of neck expanded. Now lift the crown of the head, soften the scalp, lift the crown of the head. Hands suggesting the action. Soften the scalp. Keep all of the expansion along the back. Now expand your face. How? Tip of tongue to back of upper teeth. Outer lips lift slightly. Inner eyes lift slightly. Face softening. Then lift the throat. Open the front of the throat. The inner eyes lifted slightly. And then expand the collarbone. Lift up the collarbone. Hands suggesting a pulling action. Keep the back expanded. Now expand the upper abdomen. Upper abdomen fully open. And fully expand the lower abdomen. Fully expand the lower abdomen. And then release. Good. Notice if that made you feel like you got warm without the heart racing. If you copied me there, that would be a 2-minute inhalation. We'll do it again, but this time I'm going to include a 2-minute exhalation. Okay? You might exhale a lot quicker, And you might be exhaling and then have to breathe in a bit, breathe out a bit more. It's okay, do that. Don't look for the air going in and out at this stage. Look for warmth without your heart racing through a pain-free, functional body. This can be used really effectively to traction your spinal vertebrae, to massage your internal organs. So this time we'll just do just the exhalation part, the compression part. And I'll get you to compress 12 specific parts in your body, letting the spine lengthen at the same time. So once again, sit in a comfortable position. Knees slightly below the top of the hips back, lengthen your lower back, lower front ribs back, lift and lengthen the upper back, shoulders apart, relax your throat, keep the back of the body lengthened, and expand the belly, ribs in, lift the collarbone, throat forward, chin up, and think lengthen and relax. So see if you can get further length in the fingers, further height from the crown of the head, anchoring your sitting bones, expand the back of the body more, lift the collarbone higher, and preparing with the length and relaxation, similar to what we did before, just allowing the body to breathe naturally as we expand. And now take another normal breath in, and a normal breath out, and then one more normal breath in, a bit bigger if you can, pause, let's begin a compression cycle. Draw your lower abdomen softly in if you can. As you do that, feel your pelvic floor will engage a bit, open the anal mouth. Keep pushing the lower abdomen softly in, feel it open your sacroiliac joints. Keep your lower abdomen in, anus open, sacroiliac joint back. Now see if you can round out the L5-S1 vertebrae. Now keeping the lower abdomen in, lower back rounded out. Push in just above the top of the hips if you can. Push in a little bit high for the upper back, pulling the shoulder blades backwards. Then focus on the base of the back of the neck. Push in that part, squeezing the shoulders up slightly. Push in the base of the back of the skull. So lower abdomen in, lower back round out, middle and upper back arched in. Then soften your scalp without losing the height of your spine. Then focus on the face and keeping lower abdomen in, round out lower back, pushing upper back. Let the outer eyes close a bit more. Not fully, so you still see me. Let the jaw drop slightly, the forehead slop slightly. Then soften the throat. Keep lower abdomen in, round out lower back, pushing upper back. And push in your lower front ribs gently. Lower abdomen in, round out lower back, push in middle upper back, push in the upper abdomen. Lower abdomen in, round out lower back, push in middle upper back, keep the collarbone lifted, push in chest, push in upper, then fully push in the lower abdomen. And then pause and hold the breath out for a few moments. Lengthen, relax, and restore normal breathing. Good. Hopefully you got a sense of massaging your spine, massaging your internal organs, and a sense that you got warm while being relaxed. It should feel like you're in a warm bath being massaged by someone who loves you. And this is what you really want to feel with the pulling and pushing. You can almost feel like you're pushing with your fingers, pulling with your fingers, each part of the body, and sometimes we practice this.
Now let's bring these two exercises together and focus on first expanding, then contracting for about 1 minute each in order to make a 2-minute breath. Take extra breaths wherever you need.
Sit up straight, soften the throat, face and eyes. And then take another normal breath in, a normal breath out, a normal breath in, and a full breath out, and expand. Pelvic floor, lower back, upper back, back of neck. Expand your chest, expand the upper, then lower abdomen. Gently contract, Lower abdomen in, use it to round out your lower back. Push in your middle, push in your upper back. Push in your chest, push in your upper, then lower abdomen. Again, expand pelvic floor, lower back, middle back, upper back, back of the neck. Keep them expanded. Now expand your throat, your chest, your upper abdomen, your lower abdomen, using the hands as a guide perhaps. Draw the lower abdomen softly in if you can. Round out your lower back. Lower back forward bend. Push in your middle back. Push in your upper back. Shoulders go together. Then up. Keep the lower abdomen in. Round out lower back. Push in upper back. Bring the chest and abdomen inwards fully. One more cycle. Expand. Pelvic floor. Lower back. Middle back. Upper back. Allow air in if comfortable. Keep the back expanded. Now expand the throat. Upper back, collarbone open, chest, upper back, lower back open, upper abdomen, lower abdomen open, and then contract lower abdomen softly in, round out the lower back, push in middle and upper back, push in the chest, push in upper, then lower abdomen. Normal breathing once again. And then relax. The trick with this type of breath control is you're not really focusing on sucking air in and out. Just focus on expanding the back of the body and the front of the body as I'm suggesting. And the same way that if you take your hands and you pull the hands apart, pulling the hands apart causes a suction, which will pull air into the space between the hands. We don't put air into the hands and push the hands apart. We make the hands move apart. That causes air to come in. So similarly, it's a mistake to think pull air into your nose and that's going to make the chest bigger. No, make your upper back bigger, make your chest expand, and it's natural for air to come in. This is the secret to pranayama. Don't think breathe in, breathe out. Think change the volume of your body, expanding and contracting. This makes a big difference. And you'll notice then it doesn't even matter how much air comes in or out. But with time, you can specifically make it so you do comfortably breathe in 1 minute, breathe out 1 minute.
I've got 2 more big practices for you. In this next one, I do need to give you a warning. It's not suitable for people who are pregnant or menstruating or anyone who's got blood pressure problems or if you've got, say, headache. You can still do the practice, but when I come to hold my breath, I'll be suggesting you can pretend to breathe in and or pretend to breathe out. Now, if you do this, if you hold your breath in and you pretend to breathe out, that could potentially increase pressure to your brain, which might not be a good thing. Similarly, when you hold the breath out and pretend to breathe in, this could suck blood out of the brain and make you dizzy. So 2 most important things are, 1, don't force it. You don't have to take full inhale and full exhale. You don't have to tighten the muscles of breathing, like pretend to breathe out by tensing too much. You can make a gentle attempt at breathing out, gentle attempt at breathing in. And it's important to keep what in yoga they call Jalandhara Bandha, keeping your head down and neck back slightly, and that prevents excess blood flow to the brain, and also placing the tip of your tongue to the back of the upper teeth while you're doing this. But don't force it. And for those of you who are in special conditions, when I am holding my breath and pretending to breathe in, pretending to breathe out, you can actually do the breathe in, breathe out. Take as many extra breaths as you like, but don't think breathe in, breathe out. Just allow yourself to breathe naturally while expanding, which will allow air in, and gently contracting, which will allow air out. And it doesn't matter if air goes in and out more than you think. Eventually, you can regulate this. Like me, I can comfortably do 1 breath a minute for an hour, or 1 breath every 2 minutes for half an hour. Just work on it, but don't ever force. Okay, let's begin the next practice.
The next practice, just slightly a bit further from this, will involve breathing in, and as you're breathing in, you think expand, and then I'll get you to hold the breath, if comfortable. And when you hold the breath, then I'll get you to pretend to breathe out. And then when you breathe out fully, I'll ask if you want to hold the breath out. And when you hold the breath out, you can pretend to breathe in and pretend to breathe out. This is one of the secrets you can use to eventually create breath retentions that are very, very long. Problem is, when the pressure changes inside your body, it's important that if you are holding the breath, keep your head down and your neck slightly backward with your jaw relaxed. Otherwise, you can get pressure to the head that at best you'd get a headache, but at worst you can get a stroke and die. So this type of breathing requires a little bit of safety protocols. So don't force, don't overdo, and don't necessarily take full breaths in and full breaths out. And of course, whenever you need to, feel free to just go back to natural breathing. When I hold my breath in, I'll be putting a peg on my nose to suggest that. But when I do that, you could also be breathing normally. Just remember, you don't have to hold the breath when I'm doing it. It's enough to actually do the expansion-contraction cycle without holding the breath. You don't have to use your arms, but for most people, it's a lot better. And you get a better result, as I mentioned before, for two reasons. One is because the hands take up such a large part of your brain in terms of the space the brain occupies. A lot of its hands, much more than your spine. And the second thing is, by moving the hands in the way I'm showing you, the hands moving forward brings shoulders moving forward. That keeps your back expanded. Hands moving back, shoulders going back, makes your front expand, makes the back contract. So the hand positions and the shoulder positions will actually help you change the shape of your spine. Much harder to do this if your hands are just still. Not impossible. You learn it eventually, but most people's breathing muscles are just not there yet. So I'll turn sideways again so you can see. So take a normal breath in and a normal breath out. Normal breath in and a full breath out. Begin. And expand. Pelvic floor, lower back, middle back, upper back. Keep your chin in and expand the chest and upper abdomen. Allow air in. Draw the lower abdomen in softly. Round out the lower back. Push in the middle back. Push in the upper back. And then push in your chest and push in your abdomen. Allow air out. Again, expand pelvic floor, lower back, middle back, upper back. Expand the chest and expand the abdomen. Draw your lower abdomen softly in, round out the lower back, push in the middle back, push in the upper back, push in the chest, push in the abdomen. If comfortable, hold your breath out. Chin in, neck back again. Expand the pelvic floor, lower back, upper back, as if breathing in but not, or actually breathe. Keep your chin in, expand the chest, the upper and the lower abdomen, as if breathing in but not. Then draw the lower abdomen softly in, round out the lower back and push in the middle back, push in the upper back. Then push in the chest, push in the abdomen. Release your nostrils if you're holding the breath. And again, expand the back of the body, pelvic floor open, allow air in. Expand the chest and the abdomen, allow air in. Draw the lower abdomen softly inwards, round out the lower back, and push in the middle and upper back, allow air out. Push in your chest, push in the abdomen, allow air out. One more. Expand pelvic floor, open the lower back, middle back, and upper back, allow air in. Expand the chest and the abdomen, keeping chin in toward the throat. Expand, allow more air in. Hold the breath, those who are comfortable to do so, chin in, neck back. Very gently, draw the lower abdomen softly in. Round out the lower back and softly push in the middle and upper back, keeping chin in toward the throat, jaw relaxed. And push in your chest, push in upper, then lower abdomen. Expand pelvic floor as if breathing in but not. Expand lower back, upper back. Expand your chest and your abdomen. Move your jaw, lips, face, and eyes. Release the nostrils. And now draw the lower abdomen in, allow air out. Round out the lower back, pushing middle, upper back. Pushing chest and pushing abdomen. Again, expand pelvic floor, lower back, middle back, upper back. Expand the chest and the abdomen. Draw your lower abdomen softly in, round out the lower back, pushing middle and upper back. Pushing your chest and pushing your abdomen. Let's do a full cycle. Expand pelvic floor, lower back, middle back, upper back. Expand the chest and expand the abdomen. Keep the chin in towards your throat. And then chin in, neck back. Draw the lower abdomen softly in, round out the lower back, pushing the middle and upper back. Gently pushing the chest and abdomen, like gently breathing out but not. And expand pelvic floor, lower back, upper back. As if breathing in but not, or actually breathing. Expand chest and abdomen, keeping the back expanded as well. And release the nostrils and draw the lower abdomen softly in, allowing air to begin slowly coming out. Round out the lower back, pushing middle and upper back. And then bring the chest and abdomen softly in. This time hold the breath out if you can. And expand the pelvic floor. Round out the lower back and upper back as if inhaling but not. Expand chest and abdomen as if inhaling but not. Jaw relaxed, chin in, neck back. Draw the lower abdomen in, round out the lower back, pushing the middle and upper back as if breathing out but not. Keep your chin in, neck back. Bring the chest and abdomen softly in. Release the nostrils and go back to normal breathing. How? Think lengthen and relax. Take a few extra breaths if you need, but if comfortable, restore natural breathing by dropping your sitting bones down. Move the top of your hips back, slightly lengthen the lower back, ribs back, round out the upper back, shoulders apart, relax and lengthen your throat and the back of the neck. Keep the back of the body lengthened, expand the front of the body, including move your throat forward, chin up when you're not focusing on breath retentions. In meditation, chin up is better. Now tip of tongue to back of upper teeth, lips closed, jaw slightly open. Outer lips lift in a half smile. Outer eyes half close or fully close. Inner eyes lift, gazing in a third eye center. Soften your forehead. Lengthen and relax and be still, calm and quiet in body, breath and mind. Open the eyes gently and bring down the arms. Expand pelvic floor, lower back, upper back. Lift the arms fully if you can. Keep the back expanded. Expand chest and abdomen. Allow air in. Keep the fingers going up but round out the lower back, pushing middle and upper back. Bring the collarbone down and bring down your arms. Release. Good. I hope that made you feel a bit warm in the practice.
That type of practice I elaborate much more in my courses, which I'd love you to have a look at. And I'll send you more details about those courses now, the Breath Control Foundations and Breath Control Mastery. But I hope it gave you a taste of it. This is the foundation of really, elaborate and really amazing breath control that can give you incredible energy. What I also called that particular practice is autogenous hyperbaric oxygen therapy. Oxygen therapy chambers are very big in the world, but they cost a fortune. But you can basically give yourself a type of oxygen therapy by increasing the partial pressure of oxygen and CO2 inside your body by holding the breath in and then gently compressing your body. And this pushes the oxygen further into your tissues. And I've had patients who have used this technique when they've had operations, and they found that they healed a lot faster. Autogenous hyperbaric oxygen therapy, which is what we've been doing there, is a really potent way of increasing healing when done properly in the right way. As I said, you have to take caution. Now we've got one more exercise I'd like to give you, which includes using your pelvic floor. The trick is to focus just on the pelvic floor, contracting it without tensing anything else, and then learning to expand it. And it sounds funny, but as if you're about to go to the toilet, but not. And when you do this, it's really, really good to help your diaphragm work better and to help your internal organs work better. But to actually strengthen the pelvic floor has got a lot of benefits, provided you don't over-tense it the whole time and you can control it. This can help you with sexual function, reproductive function, and it's a very powerful technique. But I must emphasize that in this practice I'm doing now, I'm giving you two options. One option is to do the pelvic floor activations, tense and relax, expand the pelvic floor, while doing natural breathing. And that's what I recommend for most of you. But on the right side of the screen, you'll also see me suggesting that you can do a breath control exercise at the same time. And it's quite a complex breath control exercise, so it's not for the beginners. Newer people, just focus on the pelvic floor, expanding and relaxing while breathing naturally. And then the experienced people, if you want, especially those who have worked with me before, you can do specific breath control. But that's not for everyone. And also those doing the breath control, feel free to go back to natural breathing whenever you like. Let's begin, and then after that, I'll offer you a moment for questions, etc. Thank you.
The next exercise that I'll do with you is a pelvic floor exercise. And for this exercise, it's really important that you do it first, at least once, where you just focus on just the pelvic floor. I'm going to guide you through it, but I'm also going to give the option that for those who wish, you can also follow me breathing in and breathing out. And this practice is a little bit more challenging if you do it with specific breath control. So what I'll do is I'll guide you with my hand going up and down as well. Hand going up, single click, means expand, allow air in. Double click, hand going down, means allow air out. My other hand will tell you where I'm expanding and where I'm contracting. So you can follow me and actually breathe with me, or you can just breathe naturally. And I'm going to show you my hands going in and out. When I tighten the pelvic floor, I'm going to make a fist to show you, because I'm not going to show you my pelvic floor. But you want to feel when I say tighten the pelvic floor, make it tight the same way that you would if you were stopping going to the toilet, but not. And then when I say expand the pelvic floor, I want you to open the pelvic floor as if about to go to the toilet, but not. Now that sounds funny. So if you feel that expanding the pelvic floor makes you want to go to the toilet, please go to the toilet, then come back. Okay? The most ideal state is to have the pelvic floor relaxed. But if you're specifically talking about enhancing reproductive function, and for several other reasons as well, the pelvic floor tightness can be of use. But the reality is most people over-tighten it. So I want you to learn to oscillate pelvic floor tightness and relaxation or opposing expansion in 3 different ways. I'll give you 3 exercises, we'll blend them as one. The first exercise is tighten the pelvic floor for 2 seconds and expand, relax it for 2 seconds. And I'm going to say the words, but you'll also see my hand. Contract for tightening pelvic floor, expand for relaxing pelvic floor. Fingers contract means pelvic floor is tightening, and fingers expand means pelvic floor is expanding. Okay? You don't need to use your hands. These are just my guide to you because I'm not showing you my pelvic floor. Okay? So when you're sitting, apply the instructions for keeping your spine in a comfortable lengthened position, back and front, and either following just my pelvic floor instructions with natural breathing, or following also the movements of inhale and exhale with that.
For this next exercise, I'd like you to make the focus to be on contracting, then expanding and relaxing your pelvic floor. For most people, just breathe naturally in this practice. When you're following my pelvic floor, you can get the cues by seeing my fist opening and closing, suggesting expanding the pelvic floor, fist open, and contracting the pelvic floor, fist closed. And also listening to what I'm saying and watching the text cues. For those of you who are more experienced, you can also follow my breath sequence. And the breath sequence I'm guiding by taking my hand up. My right hand goes up, suggesting inhale. Right hand goes down, suggesting exhale. And when my hand stops with a peg on my nose, that suggests hold the breath. My left hand will suggest where I'm expanding and where I'm contracting to allow air to come in and out. This is a complex sequence designed mainly for my more experienced practitioners. The rest of you, please just breathe naturally. Begin by sitting up straight in a comfortable position. You can watch my visual suggestions as I'm pointing in to suggest lengthen your spine, lengthen and relax throughout. The main part of this practice is involving contracting, then expanding the pelvic floor. Most people should just breathe naturally, but I'm also offering an advanced breath control sequence, which is not for everyone, and if you are attempting it, always go back to natural breathing when you need. Prepare. Normal breath in, full breath out, and expand, contract, 2 seconds, 2 seconds, while breathing in slowly if you wish, and keep following my movements, my suggestions, with my right hand going up, suggesting breathe in, my left hand telling you where I'm expanding to do so. Most people just focus on contract and expand the pelvic floor, suggested by my right hand doing that. Quick exhale, second cycle, repeat. While contracting and expanding the pelvic floor, stay relaxed everywhere else. Don't force, don't overdo. Keep breathing in, those who wish to follow the breathing sequence. And now, quick breath out. Now, quick, full breath in, or natural breathing. And those comfortable to do so, hold your breath in. Continue, contract and expand the pelvic floor as suggested by my right hand, making sure you're relaxing everything else. And while holding your breath, keep your head down, neck back. Exhale fully, those doing the breath sequence. And once again, breathe in fully. And hold your breath in as long as you can, or until I say. Don't force, don't overdo, but everyone keep contracting and expanding your pelvic floor. About 2 seconds contract, 2 seconds expand. Keep holding the breath if you wish, or breathing naturally. And now, gently exhale for 5 seconds. Keep breathing naturally, or inhale fully for 5 seconds. Now breathe out for about 25 seconds. And for most people, still just breathing naturally, but everyone still contracting and expanding the pelvic floor for about 2 seconds contract, 2 seconds expand. Still exhaling if you can. Now inhale for about 5 seconds. And once again exhale for 25 seconds. Still everyone contracting and expanding the pelvic floor. About 2 seconds contract, 2 seconds expand. Don't force, don't overdo. Natural breathing is best for most people, but advanced practitioners can follow my hand, breathing in and breathing out according to the speed and movement of my hand. Again, breathe in for 5. Now breathe out fully for 5 seconds. This time hold the breath out about 20 seconds, and with the breath held out, relax the abdomen, but keep everyone contracting pelvic floor and expanding pelvic floor about 2 seconds. Contract, 2 seconds, expand, as suggested by my right fist. I'm pointing out that my abdomen is totally relaxed. I'm even expanding my chest a bit. Again, inhale for 5. Exhale fully for 5. And hold out for about 20 seconds if you can. Natural breathing works fine here if you need. Most important thing is to stay relaxed. Notice I'm moving my lips and my jaw to help me stay relaxed. This triggers a bridge between conscious and unconscious and helps you fully relax. Now fully relax your pelvic floor in preparation for part 2. Tighten your pelvic floor and inhale for 15. Normal breathing if you need, but keep inhaling with pelvic floor tightened if you can. Hold the breath for a count of 5 and relax the pelvic floor. Exhale for 15, and while exhaling, contract the pelvic floor. Most people just breathe naturally, please. Hold out for a count of 5, relaxing and expanding your pelvic floor. And again, inhale for a count of 15 while contracting your pelvic floor. Stay relaxed in your face. Check that your breath is diaphragmatic. Feel the abdomen expand. Relax your face. And now hold the breath for a count of 5 with the pelvic floor relaxed. Notice I'm moving my fingers. You can do that. Contract the pelvic floor, and those doing the breath control exhale as suggested by my right hand by contracting the body gently. Once again, hold your breath out for a count of 5. Relax, move a little bit, soften the throat, and then expand. Allow air in, 15 if you can, keeping pelvic floor contracted as indicated by my right fist. Hold the breath in for a count of 5, relaxing pelvic floor. While holding the breath, remember to relax everything, moving a little bit, and contract and exhale. Contract the pelvic floor, exhale for 15. Moving lips and jaw can help you releasing your nervous system to relaxation. Expand your pelvic floor. Breathe in for 5, those doing the breath control. And now hold the breath for 15, and everyone contract the pelvic floor for 15. Most people just breathing naturally, but those who can, hold the breath in with your head down, neck back, jaw relaxed. Moving lips and eyes. Exhale for 5. Relaxing the pelvic floor. Hold the breath out for 15 if you can, or natural breathing. And while holding the breath out, relax the abdomen fully. Keep tightening the pelvic floor. Expand the chest as if inhaling but not, for those who are experienced. Pull down the chest, swallow, inhale for 5 with pelvic floor soft. Hold for 15, head down, neck back. In yoga we call Jalandhara Bandha, preventing pressure coming to the head, and you're tightening the pelvic floor but not the abdomen. Exhale for 5 with pelvic floor relaxed. Hold the breath out for 15, head down, neck back, and if comfortable, pelvic floor still tight. Holding the breath out if you can, natural breathing whenever you need, or the whole way through. Relax the abdomen, move lips, jaw, face and eyes. Pull down the chest, swallow, and inhale for 5. Hold the breath for 15 again, head down, neck back, chin in, neck back, jaw relaxed, face relaxed. Moving lips can help. Keep the pelvic floor tight, abdomen relaxed. Swallow. Then exhale for 5. Relax pelvic floor. Hold the breath out. Last time for 15. Normal breathing if you need. Chin in, neck back. Expand the chest as if inhaling but not if you wish. Prepare for third part of the practice. Everyone relax your pelvic floor for 1 minute. Inhale for 10 seconds. Those who are doing the breathing. pelvic floor fully relaxed, hold your breath for 10 seconds or continue breathing naturally. Exhale for 10 if you wish. Keeping pelvic floor and everything fully relaxed. And then breathe in for 10. Expanding the lower back, the upper back, the chest and the abdomen. And breathe out for 10, contracting gently the lower abdomen without tightening your pelvic floor. Round out lower back, pushing upper back, pushing chest and abdomen. Hold the breath out for 10. If comfortable, don't force, don't overdo. Everything's still relaxed in the pelvic floor. Natural breathing for most. But those who can, tighten the pelvic floor and breathe in for 10. Keeping the pelvic floor tight, face relaxed, abdomen relaxed. Hold the breath in for 10. With the breath held in, relax the face, chin in, neck back, pelvic floor tight but abdomen relaxed. Pelvic floor stays tight. Exhale for 10 if comfortable or natural breathing. And again, breathe in for 10. Breathe out for 10. Still pelvic floor tight. Soften the face. Hold the breath out for 10. Pelvic floor still tight. Now 1 minute, relax the pelvic floor. Those who can, inhale for 10. Relax and expand the pelvic floor. Hold the breath in for 10. Relax and expand the pelvic floor. Chin in, neck back. Natural breathing, those who need. Keep your pelvic floor relaxed. Exhale for 10, those who can. Pelvic floor still relaxed. Again, breathe in for 10 with pelvic floor relaxed. Normal breathing if you need. Breathe out for 10. Pelvic floor still relaxed. Normal breathing if you need. Hold the breath out for 10. Pelvic floor relaxed. Those who wish can expand the chest and upper back as if inhaling but not, with the pelvic floor relaxed, chin in, neck back. Now tighten the pelvic floor 1 minute and optionally breathe in for 10 with the pelvic floor tight. Natural breathing if you need. Chin in, neck back, hold the breath for 10. Abdomen soft, I'm showing you with my hands. Face soft, jaw relaxed. Keep the pelvic floor tight and exhale for 10, those who can. Natural breathing, those who need. Most important is to stay relaxed everywhere except the pelvic floor. Pelvic floor tight, inhale for 10, expanding lower back, upper back, chest, abdomen. Lower abdomen in, exhale for 10, round out lower back, pushing upper back, keeping pelvic floor tight. Exhale from the chest and the abdomen or natural breathing. Hold the breath out for 10, chin in, neck back, pelvic floor tight, abdomen relaxed. Keep lifting the chest if you can, chin in, neck back. Pull down the chest, swallow, and take a normal breath in, a normal breath out. And now return to natural breathing. And with natural breathing, focus on lengthen and relax. I'm suggesting where to lengthen and relax. Push down the sitting bones, move the lower front ribs in, lengthen the back of the neck, back of arms. Relax the abdomen fully, pelvic floor fully relaxed. And now bring the throat to lift up, tip of tongue to back of upper teeth, lips closed, lower jaw down, the outer lips lifted, the outer eyes down or closed, inner eyes looking up, and your forehead relaxed. Be here, be now, still, calm and quiet in body, breath and mind. Gently exhale. Breathe in. Slowly expand the back of the body and the front. Pause for a few moments. Lengthen, expand, relax together. Thank you for being here and going through all of that. I really appreciate your presence and your interest and your lovely comments, etc. Like I said at the start, this is only an introduction to really understand how to do these exercises, how to get the most benefits out of them. You really need to join my courses, and I've got two of them. One is called Foundations, and with that, I really go through the stages of breathing and how you can really make the most out of inhale, holding the breath in, exhale, and holding the breath out. And I talk about the principles and the theory and why it's so much more important to breathe less than it is to breathe more. And I show you some of these techniques that I've been sharing in this seminar. In the Mastery course, my more intermediate to advanced course, I show you some of the more fancy things you can do with breathing, including the understanding that pranayama of Indian yoga has to offer, including things like using bandha, co-activation of opposing muscles around a joint complex, and also giving you things like I suggested in exercise 3 tonight, which was the same effects that you get from autogenous hyperbaric oxygen therapy, which is so good for healing, and things like intermittent hypoxic therapy, which is essentially the benefits you get by building up CO2 inside you. CO2 really is the essence of pranayama. The essence of prana is carbon dioxide, not oxygen, as most people think. There's always enough oxygen in the air we breathe. Our body has to reduce the oxygen in the air by up to 30% less, or 30% of what it is, to actually make it useful inside our body. But our body has to increase the carbon dioxide that we breathe in by 140 times. So this is part of the theory of breathing that most people don't know. It's not about breathing more. It's about breathing less. And by breathing less, you get more oxygen to your cells, to your brain, from your lungs to your blood. Your nervous system calms down. So the two most essential things that I've been trying to give you in this session, but also elaborated on the two courses, which I'm really happy to share with you if you're interested in joining them, is that you want to minimize the amount of air coming in and out of you, generally, whatever activity you're doing, depending, and then to maximize the use and the control of your muscles of breathing. So this is what I share in my online courses, and I really hope you can join them.
I have your course for breathing for beginners, and I really loved it. However, I have this challenge that for some reason my breathing is really blocked. My chest gets constricted, the diaphragm gets constricted, and it seems to get worse when I try to pay attention to my breathing. Sometimes I'm now following the 5D course, and it feels like I started to learn sometimes to breathe using my pelvic floor, but that happens so rarely. It happened literally a couple times, and then I lose this ability altogether. So I'm wondering, what could I do to help myself to start this process?
Okay. Well, look, I think you gave a couple of hints there already, that when you start focusing on the breath, you get more problems. So a lot of people, that's what I'm saying in this session tonight, don't focus on breathe in, breathe out. Focus on staying as relaxed as you can, especially in your lower abdomen, in your pelvic floor, and try and lengthen your lower back, open your sacroiliac joints by slightly rounding out the lower back. And then instead of thinking breathe in, think of just expand your lower back, your upper back, expand the chest and abdomen. And like you mentioned about the 5-dimensional flow system, in that system, I'm also talking about lifting your shoulders, dropping your hips, and really lengthening your trunk. And that can it can be so effective to changing your breath. And like I indicated at the beginning of this section, if you want to do what many people say is very good for heart rate variability, what you often read on the internet is it's a really good thing to do to breathe in for 6, breathe out for 6, something like this. Some people even include a pause, and they say this really improves your ability to relax, it improves your heart rate variability. But most people, if they just think of breathe in for 6, breathe out for 6, they hyperventilate. They breathe more than they should, and this increases stress levels, increases your nervous system sensitivity, and it also reduces blood flow to the brain. But what I'm suggesting you do, I alluded to it at the start of this session and also really talk about it in the 5-dimensional flow courses, is just practice standing with your knees a little bit bent and move the hips down on your down towards your toes, just a little bit bend the knees, come up on your heels, and then go down on your toes. So essentially, like I showed at the start of the practice today, bend your knees, go down a little bit, come up on your heels for a count of 6, then go down on your toes for a count of 6. And if you can make that happen with your arms lifting up, and then your hips, then your arms going down, and just practice that. If you do 6 seconds come up, 6 seconds go down, that will very, very subtly bring a little bit of air in and out. But then you're not thinking breathe in, breathe out. You're thinking of moving smoothly and calmly. And this is the secret. You see, for most people, the pelvic floor is held too tight. Like Tiet, who I think is still here, was mentioning at the start, most people's pelvic floor is dysfunctional because we've been told from a very early age that you should tighten your pelvic floor, that you should draw your lower abdomen in towards your spine. Let me suggest to all of you listening right now, can you right now focus on your pelvic floor? Can you relax it more than it is right now? And almost everyone will say, actually, yes, I can relax it. In which case you have to say, why were you tightening it that much? And you can do the same with your abdomen right now. Focus on your abdomen and go, can I relax my abdomen more than it is right now? If the answer is yes, you can relax it and nothing bad's going to happen, you have to ask yourself, why were you holding your abdomen too tight? The reality is almost everyone, at most times in the day, could relax their pelvic floor more, could relax their abdomen more, and nothing bad's going to happen. Yet we've been fed this mythology which does not make biological sense, that we should be clenching our pelvic floor, that we should be holding our abdomen tight. Some people say it's better for sexual function. Some people it's better for helping your back feel better. But all it does is it restricts your diaphragm, inhibits the function of your digestive, immune, and reproductive systems, and just causes stress. And then what you find, and everyone could try this right now, a little exercise. Everyone, relax your pelvic floor, drop your sitting bones, relax the abdomen, and just if you want to, you can even feel your lower abdomen and breathe in, and you'll feel a relaxing expansion in that part, like a baby's belly, like a Buddha belly. I always say Buddha wasn't fat, Buddha was relaxed. Let your belly hang out like a baby. Now, having done that once at least, and seeing how it feels relaxing, now tighten the pelvic floor, pull your navel to the spine, harden it, and try and breathe in again. And notice how the breath goes up into your chest. And sometimes we think that chest breathing is good breathing, but actually it's only useful if the chest expands while the pelvic floor and abdomen is able to also do its breath. So now try one other thing. Everyone, take a breath into the chest. And do that. It seems so easy for everyone. But ask yourself, are you doing that with stress or with relaxation? So now check. Go back to your pelvic floor and your abdomen. Relax them. Let them hips drop down. Let the belly expand like a baby's belly. And keeping your belly expanded, now try breathe into the chest with your abdomen expanded. And almost everyone will go, oh, I can't really breathe into my chest if my abdomen is expanded, meaning my diaphragm is working. But now again, if you tighten the pelvic floor, pull in the tummy, now breathe into the chest, it's easy. Voila. It means that the only reason most people can breathe into their chest is by doing the very thing that a minute ago we felt made us feel stressed. So for Anna, for you, keep focusing on the 5-dimensional flow practices. Don't worry about the breath. Focus instead on regulating the volume of your body, which is done easiest if you're standing up, like I showed at the start of this session, and then you get much more of the benefits of what pranayama is meant to offer. You see, Prana in India is usually put into 5 categories. Prana is the energy, if you like, in the chest, but it's also called aparna in the lower abdomen. It's called vyana in your blood. And essentially, aparna is intra-abdominal pressure. Prana is the intrathoracic pressure. Udana is the intracranial pressure. Samana is the pressure of the in the internal organs. These are all types of prana, but they're essentially to do with pressure. And the ultimate one is vyana, which is blood pressure. So what you're really regulating with pranayama, affected by breath control, is your blood pressure. And blood pressure being high is not a bad thing if your blood vessels are strong. And so regular breath control can make your blood vessels strong. And then if you've got high blood pressure with strong blood vessels, you've got tremendous energy, like a tap, which when you turn it on, if the water is powerful, it's because you've got good water pressure. But if the tap is very dribbling, it means low pressure. So low blood pressure is not a good thing. It means you've got no energy. High blood pressure is a good thing if you've got strong blood vessels. But if you've got high blood pressure and weak, brittle blood vessels, which come from incorrect diet, too much stress, not enough ongoing healing response in your body, too much stress, then you've got problems. So what we really want is to have enhanced blood flow, but a really relaxed nervous system. And then when you've got that, good blood flow with a low heart rate, with a relaxed nervous system, then you've got the healing response in the body really active. So then healing, your immune system, your reproductive system, your digestive system become really effective when you've got healthy blood flow, a low heart rate, no stress, but you're also massaging your internal your internal organs with these compressions and expansions. Then you get the best results for longevity, because then your internal organs actually work towards healing your blood vessels, your joints. This is what we really want. See, everyone thinks breathe more, but actually breathe less, like you do when you're asleep, works better. But use your muscles of breathing more, like we do when we're exercising. That works better. So the secret of long-term health then is to exercise, to move your body, but feel like you're as relaxed as you are when you're asleep. You know, as a physiotherapist, one of my favorite axioms is exercise is optional, but movement is essential. And the difference between movement and exercise is exercise usually reduces stress, which turns off your immune system. But movement can be done without stress. And you know, the best type of movement is the one where everyone looks at you and goes, oh, he must be having a real workout. But you just feel like you're in a warm bath, feeling like you're being massaged by someone who loves you. I love to dance. You know, Anna, who was here before, and I go dancing at least twice a week. We go to ecstatic dance or go to big raves or wherever, or just sometimes I move without music. But the best feeling when you're dancing is where other people look at you and go, gee, you're moving really fast. But for you, it feels like you're just effortlessly flowing with a smile on your face, heart's hardly racing, but the energy is flowing. You know, I love the practices I'm teaching here tonight because for me, it's formed the mainstay of my practice for the last 55 years. And I sleep about, well, my ring, this is my aura ring, no? It's this lovely ring from Finland, which gives you sensory device and sleeping patterns, etc. It tells me that I do about average of just over 4 hours a night sleep most of the year. But I have lots of energy. I'm 65 years old this year and I feel extremely vital. And I'm functioning pretty good for a 65-year-old that should retire. Anna, thank you very much for your lovely question. I hope that's addressed a little bit, but ongoing practice will make a big difference.
I do have a few questions about the pelvic floor. This was the first time for me trying out this type of routine because I usually I didn't contract it because in my mind I kind of imagined that I always have to keep the pelvic floor relaxed. But now that I started contracting it, well, now I feel like $1,000 right now.
Really?
Yeah, it helps a lot. I followed the breathing as much as I could. As you know, I'm not experienced, so I'll have to learn that. But my main question means, is it okay if I do these exercises lying down and perhaps doing a few of these poses?
Yes. Okay, so with respect to all of that, two things. One is when you said contract, then relax, remember that it's not just contract and relax, it's contract. And when you're contracting, try not to contract anything else. And when you say relax, it's not just relax, it's expand. Almost like you're about to defecate, but not, about to urinate, but not. So those two things will make a big difference to it. Now, you can certainly do it lying down on the floor. That's fine. First 4 minutes, because you can do it without the breathing and it works pretty well. The breathing adds a different level to it. But just with natural breathing, it was 4 minutes of 2 seconds expand, 2 seconds contract. Then it was 4 minutes of 5 seconds expand, 15 seconds contract. Then it was 4 minutes of 1 minute expand and 1 minute contract. And if you just did that, it's a 12-minute exercise. This particular exercise made a big difference for me for sexual function, for example. Like, I started doing it about this particular exercise with the breathing. I started doing about 18 years ago, and I was in my late 40s, and I was starting to notice that, I mean, this is obviously personal, but erectile dysfunction was starting to happen to me in my late 40s. I was not waking up. For men, this is a typical thing as you get older, that you start having less harder erections as you get older, which is not comfortable. And it's also a sign of cardiovascular ill health. So it's not just about sex, but it's natural to wake up for men, mostly with an erection. If you don't have this is a sign of ill health. So I started doing this exercise, and I did it every day without fail for 2 years. Now I still do it, but not as often. But any new exercise that you want to really master, I believe it's important you do it every day for a set period of time. And for me, my general rule is if I'm learning a new exercise, I don't even think of teaching it to anyone else unless I've done it for 2 years myself. And I found it made a big difference. And so now I feel like my whole reproductive function is working very well, and I have a lot of energy. And like you said, it makes a big difference to your energy levels. And sometimes I feel that placing awareness in the belly, pushing it out, actually creates tensions and compressions that makes my chest hard to expand. Yes, well, this is a really important point. Don't force it, but the thing is, for most people, the only reason the chest expands is because you've consciously or unconsciously inhibited the diaphragm. So a really important practice is to learn to expand your pelvic floor, expand the abdomen, then try and breathe in the chest. But for most people, it's simply not going to happen. So the two things you can do that can help will be to, I'll stand up so you see an exaggerated version, expand the abdomen, round out the lower back, then round out the upper back. Then you're going to look pretty ugly. But the next thing is to lift the shoulders. And lifting the shoulders will be the first place that will help you expand the chest with the abdomen expanded. So this particular thing is no longer taught in modern yoga, because what I'm doing then is I'm lifting my shoulder blades and eventually lifting my arms up. And many people in the world of modern yoga say whenever you take your arms up, you should pull the shoulders down and back. And this does two terrible things. It will cause the chest not to be able to expand easily, and it will compress your lower back. So the thing that will also facilitate the ability for your diaphragm to work and not just cause the chest to expand is to keep your knees slightly bent when you're standing up, because that will release tension on your psoas muscle. So the thing you've mentioned, that your lungs feel difficult to expand, that your breathing is difficult to do in the chest when your diaphragm is working fully and your abdomen is out, that's a very common thing. So these things that will help will be working on expanding the lower back, having your knees a little bit bent when you're standing, and to lift the shoulders up in the beginning, and that will help you. And many people are experiencing what you're saying. And many people, of course, just bypass it. They say, don't expand the abdomen, just breathe in the chest. But that will usually mean you're causing a dysfunction to your diaphragm, and it means you're going to instantly turn into a flight or fight response, which will not help your longevity. Is there any difference between the breathing male and a breathing female body? Now, there is a bit of a difference, but for most of what I've said tonight, I don't I don't think you need to worry too much about it. Obviously, there's a different structure of your pelvic floor, and also with women, the fact that your internal organs, your reproductive organs rather, are mostly on the inside, whereas the reproductive organs for the male are mostly on the outside, that means you've got less space for your diaphragm to descend. So it's a little bit more difficult to make, for most men can usually do better, longer breath retentions or longer inhalations and exhalations because of this. You've also said, instead of giving my body more advice in what to do and what not to do, I feel like it is my task to listen deeper and follow more the inner rhythms and movement, and maybe making the space to make them bigger or smaller. Yes, 100%. I think trusting your intuition, intuition is really important. It's important to have good brain function, but the brain is this thinking mind in your head. What we also need to focus on is the gut brain, the intuitive mind, which is in the region between the diaphragm and the pelvic floor. And I haven't really mentioned it, but it's a really important part of what I call the 5-dimensional flow system, because all movement, all breath has to start at your core. And the core is a tiny invisible spot between your diaphragm and your pelvic floor, but at that tiny invisible spot, all movement and all breath is supposed to start. But around that spot is your internal organs, and wrapped around your internal organs is your enteric nervous system, which technically is known as the gut brain. But in Indian yoga, they call it the kunda. It's not even a well-known term in most yoga, and many of my Indian yogi friends haven't even heard of it. But it's written in the text, and it's an equivalent to, in China, what they call the dantian. In Japan, what they call the hara, the center of which is the tanden. And it's the essential feature of the core of our body, which in physiotherapy, the core of our body is related to the lower abdomen. And the lower abdomen differentiates from the upper abdomen because the lower abdomen can be isolated separately to the upper abdomen. You see with me now. So most people, when they pull on the lower abdomen, upper abdomen becomes hard. Whereas you can see I can isolate both of them separately. And this is a transverse abdominis control. And the transverse abdominis control is related to Kapalabhati Kriya, and also related in a different way to Naudi Kriya as well, for reasons I won't go into. So my point here is, Lydia, that you're talking about feeling more, not thinking. And I think all of us have to now accept that reality is not based on logic. Reality is based on a combination between logical thinking and intuitive thinking. So the logical mind is in our head, but the intuitive mind is at our gut. Trust your gut feeling, because it's really working with your gut brain, your enteric nervous system. This is a really important thing to work with. And a lot of my 5-dimensional flow course works on this, because the core can move in 5 different ways. Like the trunk can move in 5 ways. You can lengthen and shorten it, go forward and backward, sideways, twist, and you can expand and contract. And this change in shape usually means change in volume, which regulates your breath. Could you give a quick overview of the different courses you offer? I know there's an overlap between them, and also are they all included in the 200-hour course? And are they all on the HHL platform? The answer is yes. Basically, if you do the 200-hour teacher training course, which I'm just beginning now, which will go for another year, and you have a year's access if you join, you get access to all my HHL platform, Health, Happiness and Longevity platform. There's several hundred hours of material on there, pre-recorded courses, and you'll get access to all of them, including the ones I mentioned before, the yoga ones like Ashtanga Yoga, Fundamentals of Yoga, Yoga Therapy, also the Yoga Synergy courses, and also 5-dimensional flow, breathing courses, circulatory therapy courses, knee therapy courses, back therapy courses, etc. Plus, on that 200-hour course, you'll also get access to about 50 plus hours of Zoom calls like this, and then we can answer specific questions, and I'll also give you details on teacher training. Like, how do you teach someone? How do you teach yourself? Because the most important person you have to learn to teach is yourself. So my teacher training course, number one, is to learn to teach yourself. You have to find a way of convincing yourself to practice and teaching yourself in the best way. And if you can't teach yourself, if you can't even convince yourself to practice, how are you going to convince other people? So I think that's the most important thing. But you've asked the overview of the different courses. Well, that's a big story. I won't go into it fully now. But the two most important courses I'd like to draw people's attention to are the breathing courses. And the two that I've got for that are the Foundations course and then the Mastery course. And those breathing courses are enhanced by what's in my health, happiness, longevity system, because obviously breath control goes into everything. And the two most important things I'm working with will be how can you reestablish natural breathing in posture, which are stationary postures, but also in dynamic activities, movement. And that's present in all my course. I discuss it a lot in my Ashtanga Yoga course, in my 5-dimensional movement courses, etc. And then the other thing is, how can you maximize the use of your muscles of breathing? And for that, yoga postures are very important, but also yoga postures are a little bit restrictive. And often with the way most people do modern yoga, they overstretch, overtense, and that will cause stress, which will inhibit the diaphragm and cause overbreathing and overtension. So a lot of my courses, although they're not specifically mentioned breathing, are working towards reestablishing natural breathing as the first thing. Then once you've mastered that, then I can show you in several of the courses how to breathe in a way which will give you better results in terms of strength, flexibility, and fitness. If you are just doing yoga poses, I can show you how to do them better by doing specific breath control. So if you want to know more about the individual courses, I'm happy for anyone to write to me, simon@simonborg-olivier.com, or info at simonborg-olivier.com usually gets a quicker answer. And then I'll send you, my WhatsApp number. If it's a short question, I can usually answer it. If you want to have a long consultation, I'm happy to do a proper consultation for a fee, usually for my time. But if it's something quick, I can usually answer. And what we do also on the Health, Happiness, Longevity site is, because it's a membership site, we have a community. And with that, then people can ask questions, and then either other people in the community can answer, or I can answer either with a written answer or a video answer for everyone. So it's a really user-friendly environment. Breathe less and you have to eat less. You can control your weight, you can control your energy levels and your relaxation levels. I love you guys heaps. Thank you very, very much for being here. I call the system that I'm doing a way of sharing good energy and loving information through a pain-free, functional body. I think that should be the aim of your practice. Strength and flexibility and fitness can come as a byproduct. But if you make your aim to share good energy, healthy blood flow, and loving information, a dominance of your parasympathetic nervous system, that relaxation part of your nervous system, then sharing good energy and loving information inside your body can be a model for how you are in the world. And I think if everyone shared good energy and loving information with each other, the world would be a better place. So thank you very, very much, everyone. I'll say good night to you all. Bless you.